As with any psychiatric condition, the management of depression can be broken down into the biopsychosocial model. So from a biological standpoint, the mainstay of management is with antidepressants. So a selective serotonin reuptake inhibitor such as sertraline, citalopram and paroxetine are usually the first-line agents that are used. If that alone is ineffective, then an SNRI like venlafaxine may be considered. If that is also ineffective, then various augmentation therapies may be added, so a different class of antidepressants such as mirtazapine or even mood stabilizers like lithium may be effective. And finally, for severe depression, refractory depression that doesn't seem to be responding to anything else, may be considered for electroconvulsive therapy. So that's a controlled procedure in which a seizure is essentially induced in the patient using various electrical probes. And the theory of it, rather interestingly, came about by studying patients who had epilepsy and had depression, and they often found that their mood had improved after they'd had a seizure. So that's where the principles come from. So this order that I've shown on screen right now is the general pathway that tends to be used much of the time. However, it isn't that cut and dry. Like, there is going to be a lot of variation in terms of how patients respond. Side effects and everything else need to be considered as well when assessing a patient. And before stepping up treatment, it's always important to consider whether the patient has been compliant with the medication and also whether there's any additional factors that may have essentially decompensated their depression. So, for example, if they had a significant life event happening despite having been stable on a previous drug regimen, then that may be suggestive of an alternative tactic being taken. From a psychological standpoint, self-help, CBT, and interpersonal therapy are all useful. And from a social perspective, it's important to consider the effect that depression can have on people's lives. It may be the cause of the depression, so for example, if they're in some sort of financial hardship, or it may actually be a consequence of the depression that they end up with issues in their personal life as well. So attending to them in a holistic biopsychosocial way is a really good way to go about actually managing a patient with depression as best as possible. As for the guidelines, the patients will be divided into either mild to moderate depression or moderate to severe depression. If it's mild to moderate, then a low-intensity psychological intervention is recommended, so that can include guided self-help and various forms of CBT. Medication may also be considered, however, it's not necessarily recommended as a first line. However, in reality, given that the talking therapy services can be quite hard to get a hold of, patients may often be started on a medication whilst they await referral for talking therapy. With moderate to severe depression, high-intensity psychological interventions are recommended, so that includes individualized CBT and interpersonal therapy, and medication is also usually recommended at that stage.